Central City Concern has been at the forefront of dealing with Portland's homeless issues since it was founded in 1979. The agency does everything from housing to health care to addiction recovery to finding people jobs, mostly in Portland's Old Town area. Well, today, Central City Concern's mission is more important than ever as the city struggles to get a handle on a homeless problem that many Portlanders say is out of control. Juliana Lakosik is the Senior Director of Communications for Central City Concern. Welcome to Eye on Northwest Politics.
Thank you, Ken. Thank you for having me.
Well, Central City Concern just opened the Starlight Affordable Housing Project in Old Town. Cost $33 million for 100 units. Who will this help, and will it make a dent in the homeless problem that we're seeing now?
So the Starlight is really exciting. It's adding 100 new units to our affordable housing portfolio in the city of Portland. That's really important. It includes a significant number of units that are dedicated for our BIPOC community, and we're working with the Native American Rehabilitation Association, our own culturally specific programs, Imani, Caribou, and Flip the Script, in order to set aside some rooms for those folks. So we're really excited about this project. You know, as you know, there is a huge deficit in the number of affordable housing units we have in our city. So this increase is much needed.
Will it really make a dent, though? With 100 units, we've got thousands of people on the street. And, you know, there's been some talk about what is affordable housing for people who don't have, you know, much source of substantial income. Will this really make a dent?
Every housing unit we add is going to make a dent. Think about the one person who gets that unit, who gets to come out of the cold and into a safe place where they can receive services. That makes a huge dent. So is it going to be something that ends homelessness by adding 100 units? Not today and not tomorrow, but every single unit that we add to our portfolio makes a difference. Like we like to say, house keys end homelessness. And we also say that housing is health. And, you know, we at Central City Concern really believe that. And we also frequently say housing first doesn't mean housing only, and that we need a continuum of solutions, including shelters, including different kinds of housing, affordable housing, and workforce housing. So every unit we can add makes a difference.
Portland City Council just approved a $27 million funding measure to start implementation of Mayor Wheeler's homeless plan. That includes approved sites for the homeless. How involved is Central City Concern in making this happen, or at least being part of the discussion?
So we unfortunately were not consulted by the mayor or Commissioner Ryan as they led up to and revealed their plan.
And does that concern you? Should you have been consulted?
Of course, we think we should be consulted. We are truly experts in the community about these solutions. But we also know that there are a lot of factors going on, and we're not always going to be the first people everybody calls. So, you know, we want to be at the table, we want to be included, but this is a really complex issue, and the need to act quickly is pressure that everybody's feeling: the city, the county, the joint office, et cetera. So we're not going to be upset about it. We're going to look forward to continuing the conversations as we think about how that plan will be rolled out.
What do you think about the elements of the plan?
So, you know, with any kind of plan that attempts to address an issue as complex as ending homelessness, there are going to be parts of the plan that are exciting and that we're really excited about. And there are going to be parts that we have some questions about. We are over the top excited about the talk around affordable housing. How do we want to work with the city and Commissioner Ryan to make that a reality? That's really an exciting part of the plan. The part that we have questions about is really focused on the site and the navigation and the services provided at the sites, at the camps. A recent report published by OHSU and PSU's Joint School of Public Health revealed that Oregon is short 35,000 behavioral health workers. It is the single most important issue that's facing CCC and many of the other safety net providers in our community. And that's something the mayor should really be paying attention to, because the plan really calls for having supportive services on site at the camps. And we know that behavioral health workers are in high demand. There's a shortage. 35,000 in Oregon is not something that we're going to be able to solve for at the city level or at the county level. We're going to need a state and federal strategy to work on that. So that's one of the biggest questions we have.
Are you concerned at all about the proposed size of the camps? You know, at least 250 people up to 500 people, and also where they will be sited, because we don't know where they're going to be yet.
Yeah, you know, like the rest of the community, we are concerned about the size and we are concerned about the locations. And we're also concerned about sort of how we're going to manage the different and increased use of different kinds of opioids, especially P2P and fentanyl. You know, are folks that are using those drugs going to be allowed into the camps? And if not, where are they going to go?
Is Central City concerned working with other agencies, especially in Old Town, you know, like Union Gospel Mission, Sisters of the Road, as well as trying to make inroads with the city to deal with what's happening on the street? Are we looking at a holistic approach to this problem?
Oh, thank you for asking. That's such a great question. We are really in a unique position where we're able to really engage with all of the stakeholders around these issues. We work closely with the city. We have contracts with our Clean Start program, one of our social enterprises. We have relationships with the joint office and with the county and with the region. So we are deeply engaged with those elected officials, and we also are engaged with the business community. The business community recently supported our annual fundraising event, and they stepped up and they showed their support for Central City Concern. And then, of course, we always are working with our colleagues and the other safety net providers around the community, because quite frankly, Ken, it is time for us to all focus on the future, reset in January, sooner if possible, and start working together to solve these issues, because it's going to take all of us working together to make a dent in this problem.
We've only got about 30 seconds left, but it's getting colder now. Are there enough resources out there to keep people from having to survive on the street when the weather gets pretty brutal?
You know, it's always a concern. We have outreach teams that bring along supplies to help folks. We are working with Multnomah County on making sure we know where and when the warming shelters are happening. It is a deep concern. But one thing I want to tell you before I lose my time today, because I know how busy this schedule is, but I want to say this. People can recover from being homeless. They can recover from being in recovery services and addiction. I get to see stories every single day of people who have recovered from some of the worst challenges that you can imagine that they're facing. So I just want to end on that really positive note. We can solve homelessness and people can recover.
Juliana Lukasik of Central City Concern, thank you for being here on Eye on Northwest Politics.
Thank you for having me, Ken. Have a really great show.
You too.